Are you constantly battling with weakness that doesn't seem to go anywhere, even after getting a decent sleep? Did you know that this is among the classic symptoms of acute pancreatitis? Or do you sometimes experience belly pain that seems to get worse after eating? If so, this could be an indicator for chronic pancreatitis. In case you are wondering, yes, the symptoms of acute pancreatitis and chronic pancreatitis are not the same. In this video, we are going to talk about 6 signs of acute pancreatitis, 6 signs of chronic pancreatitis so that you can differentiate the two, which could help you safely recover from acute pancreatitis before it becomes chronic. Finally, we will talk about 10 simple, yet effective ways to revive a struggling pancreas. Symptoms of acute pancreatitis. Acute pancreatitis often presents with a swollen and tender abdomen, indicating inflammation. Patients typically have a rapid pulse, a response to stress and inflammation. The pain worsens after a high-fat meal due to increased enzyme release and is more intense when lying flat. Fever is common, reflecting the body's immune response, and individuals often feel weak due to the overall impact on the digestive system. Symptoms of chronic pancreatitis. Chronic pancreatitis often causes persistent nausea and vomiting. Patients typically experience weight loss due to impaired digestion and nutrient absorption. Diarrhea is common, along with general digestive upset. Stools may be pale, oily, foul-smelling, and float due to undigested fat. Additionally, individuals suffer from deep abdominal pain and tenderness that radiates to the back. It's important to be able to differentiate between the symptoms of acute and chronic pancreatitis so that you can act fast if you are dealing with acute pancreatitis before it becomes chronic. Now we will talk about 15 simple, yet effective ways to revive a struggling pancreas. 1. Improve intake of omega-3 fatty acids. Researchers analyzed 8 clinical trials with 364 severe acute pancreatitis patients. Some received omega-3 supplements, while others did not. The study found that omega-3 supplements reduced the risk of death by about 75%, lowered infection rates, and shortened hospital stays for those treated via feeding tubes. 2. Improve gallbladder health. Severe gallstones can cause inflammation in the pancreas and result in pancreatitis. Pancreatitis is one of the possible complications associated with gallstones. Making lifestyle changes can help lower the risk of developing pancreatitis due to gallstones. 3. Glutamine. Glutamine, an amino acid, aids in food digestion and strengthens the immune system. In severe acute pancreatitis, infection is a leading cause of death. Studies show glutamine supplements enhance immune response, potentially helping to combat infections. One study reviewed 12 clinical trials involving 505 acute pancreatitis patients. Some received glutamine, while others did not. Results indicated that those treated with glutamine had a 40% lower risk of complications, particularly infections, and a 70% lower mortality rate compared to those who didn't take the supplement. 4. Eat antioxidant-rich foods. A large study published in the Journal of Gut suggests that consuming plenty of vegetables in one's diet might assist in preventing the onset of acute pancreatitis. A research conducted in northern Italy spanning from 1991 to 2008 proved that consuming a group of antioxidants called proanthocyanidins was associated with a reduced risk of pancreatic cancer. It was even estimated that consuming an extra serving of proanthocyanidin-rich fruits like apples, pears, grapes, and pulses daily lowers the risk of pancreatic cancer by 25%. 5. Turmeric. A 2019 study by the National Library of Medicine reported that curcumin has been reported to reduce markers of inflammation during acute pancreatitis. A good example of how you can include turmeric into your diet for the benefit of your pancreas is turmeric tea, where you brew a cup of turmeric tea by steeping turmeric powder or grated fresh turmeric root in hot water. 6. Licorice root. A 2023 study published in the Journal of HerbMed Pharmacology found that licorice extract reduced inflammation markers and enzymes in the blood associated with acute pancreatitis, and also decreased oxidative stress markers in the pancreas and lungs. Additionally, research from Hong Kong Baptist University indicated that isolicoritiginin, a flavonoid in licorice root, shows potential in fighting pancreatic cancer, which is the 4th leading cause of cancer deaths in Hong Kong. 7. Avoid fatty foods. Fatty foods, particularly those from animal sources and deep-fried items, can cause inflammation that harms the pancreas. 8. Avoid alcohol intake. Binge drinking alcohol poses significant dangers to your pancreas, including the risk of dehydration, which exacerbates harm to this organ. Research indicates that alcohol and its metabolites damage the acinar cells in the pancreas and cause stellate cells to initiate the necrosis-fibrosis sequence. This can result in dead tissue, atrophy, and fibrosis, all of which are indicators of pancreatic inflammation. Additionally, it can promote the development of pancreatic cancer cells. 9. Reduce acidity. Persistent acidity in your digestive system can damage the pancreas. Even a single minute of acidity and acid reflux can negatively impact pancreatic health. 10. Chew your food properly. Properly chewing your food eases the strain on your pancreas. Additionally, it stimulates the production and release of digestive juices and enzymes. Aim to chew your food until it reaches a paste-like consistency before swallowing. It's crucial to seek advice from a healthcare professional or a registered dietitian before making major changes to your diet or lifestyle, particularly if you have an existing pancreatic condition or other health issues. They can offer tailored recommendations that take into account your unique needs and medical history. If you found value in this video, consider supporting us by liking the video and subscribing to the channel for more videos on how to keep our delicate organs healthy.